Afternoon, and thank you for joining us here today as we have some very important information to share regarding COVID-19 and the recent spike of COVID-19 in our community and actions that the county will be taking to try to reduce the spread. Of course, I'm Erie County Executive Mark Polenkars. I'm joined here by Kendra Schmidt from Deaf Access Services, who will be providing the American Sign Language to our friends who may have a hearing disability. And I'm also joined by Dr. Gail Burstein, and you'll hear from her soon. We're going back to the type of virtual type of press conference. Other than cameramen, there is no other media present. They are all available online, and they will be eligible to ask questions a little later. But first we want to get into what we're seeing. So the most recent data which we have is as of November 21st. There were 371 new cases on the 21st. 4,353 total new cases in a 7-day period. As we'll talk, this is one of the largest 7-day periods we've ever seen. 456 total new cases per 100,000 residents in the past 7 days. It's also one of the largest numbers we've ever seen, which is equal to 120,221 total confirmed cases in Erie County. Remember, anything above 100 is considered a high risk of transmission, and we're 4 times as high as what the CDC determines as a risk of transmission. Now, the 371 new cases seems a little low compared to some of the things we've had, but the positivity rate for days recently has all been the same, around 9%. In fact, COVID-19 cases have increased 22% or so from the previous week and increased by 100% over the past 4 weeks. The highest case numbers are in the 30 to 39 year age category. And unfortunately, more children under the age of 18 tested positive. It increased by about 16% week to week. This is all based on a preliminary review of week ending November 20th data. So this is the data that's being preliminary reviewed right now for the ending as of the week that ended on Saturday. But as we noted, there's some really high dates that we've seen. November 18th and 19th were the 4th and 3rd highest new case dates on record, respectively, since the beginning of the pandemic. There were 774 new cases on November 18th and 778 new cases on the 19th. And the positivity rate for the past week has not decreased, even if the case totals have. So we showed you that on the 21st, there were 371 new cases. Doesn't seem like a lot, but the positivity rate was over 9%. Reason it's only 371 new cases is because there's not as many people who are tested, usually on Saturdays and Sundays. So those numbers are generally a little lower than what we see in the weekdays. So we look at the positivity rate to see, is it going down or is it going up? It's not going down, even though the case numbers were going down. And as you see, we're expecting, once we actually get the case data for today and tomorrow, to see a big spike again of raw cases in the 700 and hopefully not 800 category, just because of the amount of community spread that exists. So we have a weekly student and school staff COVID-19 cases. You'll see the bars going up for both students and staff. Substantial increases in kindergarten through grade 12 among students and staff, higher than any previous weeks in 2020 and 2021. And it's unfortunately reflective of the community prevalence. Our Department of Health, and you'll hear from Dr. Burstein later, we are seeing transmission in school activities, and we know there's a number of classrooms that are closed in various schools across Erie County, not entire schools, but classrooms, as a result of what appears to be in-classroom transmission with the number of students who are testing positive. We know we've heard often you can't get COVID-19 in school. We know that is not true. People have caught it. It is a safe environment if masks are worn at all times. Doesn't happen sometimes in all situations. So we're seeing case rates increasing in schools, and it is reflective also of what appears to be some in-school transmission among classrooms. The hospitalization data, and this is really key. We really need to keep the hospitals from getting completely inundated with patients. They have seen an increase of about 50% in the last 2 weeks. The most recent date we have is November 20th, Saturday, 249 COVID-19 patients, and an increase in ICU patients up to 50. And of course, ventilated patients has also been a little higher recently as well. Our hospitals are at or near capacity, depending on the hospital, based on their staffed beds, because they are, of course, dealing with staffing shortages like everyone. The total of all beds available, basically 91% are full. And ICU beds, 87% are basically full. The one thing I also want to highlight are the numbers that's that kind of gold bar in our line on the bottom. There's been a significant number of deaths in Erie County hospitals of individuals from COVID-19 in the past week. There were 7 deaths alone on November 18th and 5 on November 5th, or 17th and 18th. We've had some of the highest death totals coming out of hospitals lately. They're not all Erie County residents. Some of them are residents of other counties, but we are seeing a growth in cases, a growth in ICU numbers, and unfortunately recently a growth in death. And as we know, and as we heard from during our discussion last week with hospital leaders, that approximately 10% of the people who enter hospital and are hospitalized for COVID-19 die from the illness. So that means if there's 249 people that are currently in the hospital, or was as of November 20th, we would expect that about 25% of them, or 10% of them, or 25 would unfortunately perish in the long run. That's not a good number. So we want to keep the hospitalizations down, and we're going to talk, that is the number one factor. New cases is very important because it usually is indicative of the rises in hospitalizations later. But we really need to keep the hospitals from being inundated for various reasons. You'll see the hospitalization chart from the beginning of the pandemic to now, and you're starting to see that lines going straight up again, very similar to what we saw at the end of November last year. And as has been projected, unfortunately, by the Western New York COVID-19 Analytics Work Group, headed by Dr. Peter Winkelstein of the UB Medical School, they're expecting, if we trend at the current rate, and this was actually as of the data provided to them, I think through November 18th, that we would hit somewhere around 400 patients by the end of this year. I think we're actually going faster on the rate than they actually expected, because it's a very good chance we will hit 300 patients if we continue at the current rate by December 1st. So that's very scary. We need to keep that rate down, otherwise we're going to see our hospitals get inundated with patients. So this information from Dr. Winkelstein's team indicates that we are going to continue to see a rise. Dr. Tom Russo of the UB Medical School informed me he expects this current wave to continue with a vengeance, at least through January, at which time it may burn itself out finally, because it's basically run out of hosts. People who are protected from the vaccine are those who are unvaccinated. So it is going to be a very, very tenuous period, and if you're unvaccinated, you are really taking a chance with the rate of transmission in our community due to the Delta variant. And I'll let Dr. Burstein talk more about that, but these numbers are not good with regards to hospitalization and the projections for the near future. Vaccination numbers through November 21st, these are percentages of people with at least one vaccine dose by age group. You can see that in general, our older population has received at least one dose. Most of them have gotten 2 doses by now. But literally 65 to 74-year-olds, 99% have gotten at least 1 dose. 75 plus, about 90%. 55 to 64, now it's dropped off to about 84%. But we see some lower numbers in the younger age categories, including those who've been eligible to be getting doses for some time, especially those in the 26 to 34-year age category. It's basically 69%, so there's a substantial amount of our individuals working in the community who are not vaccinated, and unfortunately it's that 30 to 39-year-old age category that has the most doses. So we want to inform everybody that the best and fastest way out of this, once again, is to get vaccinated and to protect yourself. Get vaccinated. We know there's some people that haven't for various reasons, but it will protect you. It will protect you from serious illness and hospitalization, and it will help us reduce the overall transmission rate. So I'm going to turn it over to Dr. Burstein to talk a little bit about Erie County Responds, what we're doing, and then I'm going to come back up to talk about the measures we will be taking and the approach we have after talking with the community leaders, those in the medical profession, as well as our friends in the business community. Dr. Burstein says she still hasn't grown. I have to put the little thing out.
Thank you. Thank you. Good afternoon. So I'm going to be talking about some of the ways that Erie County Health Department and all of Erie County is responding to our pandemic. So as the county executive mentioned, we're seeing sustained high levels of COVID-19 cases diagnosed throughout the community. We are seeing widespread community transmission. We're seeing people that are getting infected among households. We're seeing people identifying that they've been infected in parties, even private parties, gathering with friends at bars, at restaurants. But people can be infected anywhere. We don't know exactly where people are getting infected. You could be infected with talking to a friend in a grocery store aisle. You could be infected with talking to the person that's cutting your hair for 10 or 20 minutes in a hair salon. You can be infected anywhere where you are not wearing a mask and the person you're with or the people you're with are not wearing a mask. We are seeing most of its transmissions in situations where people are not wearing masks. And we know that the Delta variant is very, very contagious, and it is spreading like wildfire in our community, especially among people that are not wearing masks. In people that are living in closed, contained spaces that are fully vaccinated, like people in nursing homes, we're not seeing a lot of infection. With our most recent nursing home data, there are only 28 confirmed cases out of a total of 4,525 residents. So those residents, they're all fully vaccinated, they're taking the right precautions, and they are not getting infected. So these infections can be prevented if people take the right precautions, including masking and especially getting a vaccine. And we know that the numbers are only going to get worse. There are going to be more holiday gatherings coming up. There's going to be more people traveling. And we've seen from last year, when we started off with a lower number in November, that our numbers went skyrocketing in December and January. And so we expect to see the same thing and even worse, because our numbers, our baseline number now, are higher than they were in 2020, even despite what we have in place with vaccinations. Everybody needs to get vaccinated. So our hospitals are also in dire straits. We know that our hospitals are at or very near capacity, and we have to do whatever we can to keep people that don't need to be in the hospital out of the hospital. And that means prevented COVID-19 infections, because that is one disease that people get hospitalized for that we can prevent. We hear in the emergency departments for people that are not critically ill, that don't need to essentially be in the hospital, they're in for something minor, you're going to be waiting for 8 to 12 hours. So because the hospitals are so full. And we have to avoid what happened in the South. Remember in the past where hospital beds got filled up and people didn't have a place to go to get taken care of, and some people died. So it's really important that we make sure that we keep our hospital beds as open as possible. And that's one thing that we can all do. We can't prevent the heart attacks, we can't prevent the strokes, we can't prevent all the motor vehicle accidents, but what we can prevent is people getting infected with COVID-19, because they're also taking up many of our ICU beds, and they're also taking up many of our ventilators. So I'm going to turn it over to the county executive to talk about our next phase of approach.
Thank you, Dr. Burstein. As you will see on the screen, after talking with many leaders in the community, from the medical community, business community, and I'll go into some of that more, Erie County will implement a 4-phased approach to reduce caseloads and control hospital capacity issues. The first phase, which we'll be implementing effective tomorrow, and I'll go into greater detail, is a mask mandate for all indoor public locations in Erie County. So as we'll go through in greater detail, the patrons and the staff that are public facing and deal with the public and patrons that come in will all have to wear a mask. This is being done in conjunction with the emergency powers that are provided to me under New York State's Public Officers Law, as well as the powers that are given to Dr. Burstein as a commissioner and the commissioner orders under the New York State Public Health Law. The state of emergency still exists in Erie County. We kept it in place so that we could deliver faster vaccine delivery as well as testing during the summer. We didn't think we'd need it for a situation as it is today, but we do. So the emergency powers and the state of emergency is still in existence. As a result, we are implementing this four-phased approach. Phase one, mask mandate for all indoor public locations in Erie County. If that doesn't work, and we'll talk about how we'll go from phase to phase, we would then be implementing a vaccine mandate for all interior restaurants, bars, theaters, and the like, where people are staying for quite some time. If that didn't work, we'd end up doing capacity restrictions on places where the public goes, like bars, restaurants, barbershops, gyms, and the like. And if that didn't work, we do shutdowns. Now, trust me, folks, we only want to do phase one. Nobody wants to go to phase two. And phase two is unnecessary if we act appropriately. So phase one, mask mandate for all indoor public locations in Erie County, effective tomorrow, Tuesday, November 23rd at 6 a.m. Masks must be worn by all patrons age 2 and older who are able to medically tolerate a face covering and are all publicly facing staff. This is the same standard as we had earlier in the year, at the end of 2020. Bars and restaurants have to wear a mask while entering, walking around. If you're seated at the table and eating, of course you can take your mask off. Grocery and all other stores, doesn't matter if you're going to Tops or Wegmans or Target, Lowe's, Home Depot, have to wear a mask at all time, including all staff that are publicly facing and dealing directly with the public. Theaters, movies, live theater, must wear a mask at all times. Barbershop and beauty parlors, you must wear a mask at all times, so must the beauticians and the barbers. We know how to do this, we went through it before. Gyms and fitness centers, same thing. It's not always fun, but I'd much rather wear a mask working out, which I've done, than not working out at all. Entertainment venues, hockey rinks, bowling alleys, and the like, gotta wear a mask. Hotels, banks, and all other places open to the public, gotta wear a mask, including the staff. We know the greatest way to reduce transmission is to wear a mask. We also know the best way to prevent COVID-19 illness and serious illness is to get vaccinated. We need people to get vaccinated, and we need people to wear a mask to prevent further transmission. If we do that, we'll never go into phase two. But we have proposed a phased system to review and determine if we need to take greater action. So the next phase, oops, going the wrong way. Next phases. Plan is to assess the need for additional measures using COVID-19 case data, case rate, and hospitalizations in 3 weeks, December 13th. Unless conditions require an earlier implementation. If we are going downward in cases and hospitalizations, especially hospitalizations, we won't need to go to phase two. But if we see tremendous increase in hospitalizations as a result of increases in cases, we will then implement phase two, which is vaccine mandate for indoor dining, bars, and entertainment venues. In other words, you cannot go into the facility unless you've been vaccinated. Very similar to what you see in New York City right now. If that doesn't work, we then would have a phase three, which is capacity restrictions for all public locations, similar to those that were implemented by New York State in 2020. 50% capacity in restaurants, 6-foot difference. Also the issues we saw with the barbershops and beauty parlors and gyms, we would implement those if phase two didn't work. And then finally, phase four would be shutdowns. None of us want to even go past phase one. None of us wanted to do phase one. We did not want to have to implement mask mandates for all indoor locations, but we feel we must. We last week were pleading with the public to wear masks, get vaccinated. We haven't really seen that big tick in vaccinations except for the very young age category where they're finally able to get vaccinated. And we've seen the data. We've been out in public. We've seen what people are doing. No one was wearing a mask in most places, it's just a handful, and we feel it's necessary to protect what will certainly be the further spread of COVID-19. So if we do the right thing now, phase two, phase three, phase four, you'll never see. Let's wear a mask, follow the rules. The Erie County Department of Health, of course, will be going out to confirm that the rules are actually being followed. Sanitarians will be going out. We'll be following the same protocols as before. We must take united action to prevent additional phases. Now, this decision was not made alone by us in Erie County. It was made in consultation with community and business leaders, as well as those associated with the medical profession. Medical profession was basically pleading with us to do something. We are doing something. I've also talked to Governor Kathy Hochul multiple times, including about 2 hours ago. She fully supports the actions that we're taking and the measures that we're taking. And I thank the governor for her continued vigilance with regards to COVID-19. I've talked to business leaders, Renee Jones, CEO of M&T Bank, Dottie Gallagher of the Buffalo Niagara Partnership, who's actually in Ireland right now, and we were texting back and forth about this earlier today. John Dandies of the COVID-19 vaccine team and Rich Products, Robert Joy of the Oshai Foundation, just some of the community leaders I talked to who all support the actions we're taking. Restaurateurs, we talked to restaurateurs. I want to thank Joe Yerge of Mulberry's Restaurant in Lackawanna. He helped set up a discussion between myself, a couple members of my team, and other restaurateurs yesterday. Everyone was getting ready for the game. We were sitting down at Ilya DiPaolo's talking about what was necessary for this region. And what they've said is if we go immediately to vaccine mandates or restrictions on capacity, it will devastate, it will decimate the area restaurant industry. They're just getting back on their feet. They have the most important season coming up, the holiday season. They all support a mask mandate. So I want to thank Joe Yerge of Mulberry's, Dennis DiPaolo of Ilya DiPaolo's, and you hear from both of them hopefully in just a few seconds. Jay Pascarella of Lucia's, Damon Ayer of Mason's Grill for sitting down with us and explaining the issues that they face, the issues that are related to staffing and what would happen if we implemented vaccine mandates or we went to capacity restrictions. We need to come together as a community to get through this, ensure our local businesses not only survive but thrive. We do not want to implement vaccine mandates for restaurants, bars, and the like. We do not want to implement capacity restrictions. Why? Because we want to protect our local business community, but we also have to protect lives. So the first step is a mask mandate. I think we have Joe Yerge of Mulberry's and Dennis DiPaolo of Ilya DiPaolo's on. If you can, allow them. If Joe and Dennis, you want to say a few words, I do thank you for taking the time out of your day. We're also going to be setting up specialized vaccine clinics for the restaurant industry so that their employees can get vaccinated. I want to thank them for offering that. I don't know if Joe and Dennis are on or if we got the system working. Are they there? Increase my volume.
It's Joe, Mark.
Hi, Joe. We got Joe Yerge from Mulberry's. Joe's also a former Lackawanna council member, so he understands a lot of this issue. So, Joe, would you like to just say how it's important that we don't go to phases 2, 3, and 4 because of the impact it would have on the restaurant industry?
Not just the restaurant industry. I think most industry in general, and obviously, Mark, thanks once again for taking the time to consult with us and meet with us and talk about it. I don't know that that's been done in governments elsewhere, but certainly it was great that you initiated the call with us to talk about it and try to avoid another shutdown or things that could possibly have a negative impact on business. But as you touched on, I know Dennis and Jay and Damon and myself are all supportive of the measures that you're taking to try to get these numbers down to a manageable position, and we're going to do all we can, as we have in the past, to help you and to help to keep Erie County safe.
Thank you, and that's what it's about. That's about protecting the public, keeping Erie County safe, but keeping our businesses open. Letting people know that the key is we need to keep our businesses open. We need to keep people working. We don't want to have capacity restrictions, and we don't truthfully at this want to limit the amount of people who can actually go into a restaurant because of vaccine mandates. But those are options we have in the future and will implement if we have no choice. So I think it's important that we just work together as a community to protect our business community and protect lives. So I thank you, Joe, for being supportive. I don't know if Dennis is on. You're welcome. I'm not certain if Dennis is on or not. If not, I do want to thank Dennis DiPaolo of Ilya DiPaolo's, one of the greatest restaurants in our region and a tremendous tradition, for their support in offering, even holding a vaccine clinic for the restaurant industry in his banquet facility. It's something we are going to take on, and we're going to work together to vaccinate more people, because of course vaccination is the key out of this, but to ensure that we're keeping our hospitalization rates down so our hospitals don't get flooded to the point where they can't provide the service to the public because they don't have the staff or the beds to do it. With that, I'm going to turn it over to Dr. Burstein to talk a little bit more about some of the other measures we're taking to protect our public.
Thank you. So, as the county executive mentioned, masking, vaccination, distancing, that's all very important. Still is important to know your status. We don't know who is transmitting infection to whom if we don't know who is positive, to put them in isolation or put yourselves in isolation and make sure we don't transmit infection. So we're finding that most people with COVID-19, when they start off early in infection, they have like mild symptoms, like a little cold, like a little sinus thing. They think it's allergies. They say, oh, I usually get this every time a year. But this could be COVID. You don't know unless you go to test. So even if you have just like a little sniffles, it's really important to get a test to know your status so you don't infect everyone else in your home and everyone else in your friends and family and at school or at work. So Erie County Erie County residents have free access to Erie County Health Department diagnostic testing at one of our sites. We offer PCR testing, molecular diagnostic testing, and those results should be back in 1 to 3 business days. And then we offer the rapid nucleic acid testing, which is available with the ID Nows. And we're only making those available right now to our Erie County K through 12 students and staff to, if they're symptomatic, because we want them to make sure that they return to school as soon as possible. For anybody who wants to get tested from the Erie County Health Department, all you have to do is to get a test, is to give us a call, and we can make an appointment. 716-858-2929. So again, any Erie County residents can get a test from us free. We're also offering vaccines. We have vaccine clinics on our website at erie.gov/vax, and we're going to be posting more, and it's with some additional brick and mortars in the north towns and in the city. Also, we welcome walk-ins, but it goes a lot faster if you register beforehand, but we do welcome walk-ins. We also have a home vaccination program called VaxVisix. All you have to do is call 716-858-2929, and we'll give your information to Buffalo Home Care, our home nurse agency, and they will call you and schedule a time when they can come to your home and vaccinate you and whoever is eligible in your home. And that is for any these are all for any population. So if you need a 5 to 11-year-old vaccine, you need you're 12 and up, need a first dose, second dose, booster dose, third dose, we can give any of them, and so can the home vax visits. So one thing that we're trying is, because we're seeing so many cases in the schools and we're seeing so many kids stay out in quarantine for so long, we're offering an option that the CDC offers that people can test out of quarantine after 7 days. So remember, first of all, if you're fully vaccinated, you do not need to quarantine at all. So this does not even apply to anybody that is fully vaccinated. However, for those who are not fully vaccinated, they need to quarantine. So with this option, this test out of quarantine, people can, if they're asymptomatic, they can end their quarantine after they finish the 7 days of quarantine. So on day 8, if they continue to be asymptomatic and they have a negative test within 48 hours of the end of their quarantine. So say, for example, somebody is in quarantine, they're not vaccinated, they were a close contact, they don't have any symptoms, not even the sniffles at all during their duration of their quarantine. They can get a test on day 5. And if that's negative, after they finish day 7, so that means on day 8 of their quarantine, they can leave quarantine. So we have all the information on our website about how you can download your own isolation and quarantine affirmations. At our health department, our contact tracers are super busy, and so we're leaving it up to the public to go onto our website. If you need documentation about your isolation period or your quarantine period, then you can go on our website, download our isolation and quarantine forms, fill those out with your dates. If you're leaving quarantine early after 7 days, make sure that you have your negative test result available too. So if you need to show that to your employer or to the school, that you'll have that. So the website is erie.gov/IQ. That is erie.gov/IQ for isolation and quarantine. So with that, I'm going to turn our questions over to our county executive.
Thank you, Dr. Burstein. We will open up the phone lines to our friends in the media right now. And we will start with the Buffalo News. I think Tom Prohaska is there. Tom, are you there? Do you have a question?
Yes, hi, Mark. Does this change, I don't think you specifically mentioned theaters and performances, did you? Does that change anything for them?
No, they have to mask.
They do have to mask also.
Yeah, so the staff, that would be like ticket takers and ushers, they would have to mask, as well as the patrons. I thought that was in there.
Yeah, you said you'd revisit this on December 13th. How will you know? Do you have a threshold in mind as to how you will know that things are going better and you can lift this?
We're going to be looking at the hospitalization numbers, the positivity rate, and the new case rate numbers. As I said, we could have less people tested, but have the positivity rate go up means that there's greater spread in the community. We're also going to be looking at the hospitalizations. If the hospitalizations stayed stagnant, they didn't increase, then we would consider on December 13th saying, well, we don't need to go to phase 2. If they've gone up appreciably and above what truthfully the or the Western New York COVID-19 Analytics Group expects us to be, then we might consider at that point moving into phase 2. So it's going to be dependent on a bunch of variables. I don't want to say there's one specific thing that's a threshold that says, aha, we go to phase 2. Now, if in the next 5 days we see tremendous increase in hospitalizations as well as new cases, we theoretically could go to phase 2 sooner than December 13th. But we want to give it at least enough time to analyze what's being done, assuming the public follows and wears a mask. And that's why we're going into phase 1 effective tomorrow at 6 a.m.
Is any decrease in those statistics good enough to lift this, or does it have to be a particular amount? Well,
I'm not going to get down and say there's a particular amount. A decrease would be very, very welcome. Let's put it that way. If we're decreasing in hospitalizations and cases and positivity rate, there would be no reason to go to phase 2. At that point, then we'd have to question whether or not we should end the mask mandate. So I think it's important that we look at it as we have to look at everything in total, as we always have. It's the totality of the circumstances, not one particular item, though the hospitalization rate is key. If the hospitalization rate is going down, that's a good sign. Next question to Tom Dinky of WBFO.
Hi, Mark. You mentioned you have the approval from Governor Hochul. Did she give you any indication, or did you ask her if the state is going to step back in with their own thresholds for restrictions? Will these pandemic restrictions ever go back to kind of being statewide decisions?
I do not believe they'll go back to statewide. I did talk to the governor, and she fully supports the actions that we're taking. The governor has noted recently she's empowering local governments, not just myself, but the other local governments in Western New York and elsewhere, to take appropriate action. And we think that this is appropriate and fully supported by the state. I don't have any indication of the state moving forward and doing its own type of actions again, but it always might. That question is better directed to state representatives with the governor's office. But I do know the governor fully supports what we're implementing here. She thinks it's appropriate. And if there are additional resources we need from the state, she's offered those resources to us. One thing I didn't note earlier, but I wanted to, is we're also going to be offering some locations that we'll be announcing very soon where the public and others could pick up masks. So if you need masks, we got lots of masks, and we'll be offering those to the public, and we'll be announcing those locations soon, as well as places where businesses can contact us so that they could pick up masks for their employees or their patrons. Next question goes to WBEN, Tim Wenger.
Hey, Mark, thank you. Nowhere has masking been more consistent than in schools, yet you say COVID transmission continues in schools. Why the mask mandate then throughout the community if it's not necessarily working in schools?
Well, what we're seeing is an increase of school-related cases. In most of those cases, we believe, were caught outside the school setting. We do have a few classrooms that are being watched, and truthfully, some of them are shut down because it does appear there may have been some in-classroom transmission. Now, we also have to look where those students truly wearing their masks? Was the teacher wearing their mask? But we've seen overall is in a mask wearing situation, you don't have the spread. We know that from Erie County government. We require masks indoors for individuals when they're traversing the hallways and the like, and we have not seen the increases of what would be considered in-work transmission in Erie County government if people are wearing masks. When we allowed people to take off masks this summer, we started to see the in-work transmission. So we know it works just because we see it from our own family in Erie County. It is a well-worn, well-used method to protect transmission. And I'll turn it over to Dr. Burstein to finish answering this question because as it pertains to schools, but also there's new data that's come out recently that she's been sharing with us that shows masking works. Masking spreads the transmission of the illness.
Thank you, County Executive. So unfortunately, we do see transmission associated with the school, not just in the classroom where people may not be compliant with masking. However, and we know that most schools are taking mask breaks too. So there's an opportunity. We know kids are eating lunch in the cafeteria together, and so there may not be ample room for kids to be spread 6 feet apart. They have their masks off when they're eating, they're talking, they're spitting. So that can be an opportunity. We know the buses. We've received, actually, even this morning, reports about school buses where, kids are not sitting in their assigned seats, their masks are off, they're running all over the place. I mean, it's really difficult to supervise what's going on with a bus because there's only one bus driver and that person's eyes are forward, not backwards. So there's another opportunity for transmission within the schools. And then sports. We know that the students are getting changed in the locker rooms. And there's probably very little monitoring of what's happening in the locker room when the students are getting dressed or undressed to prepare for the game. So there is opportunity for transmission in the schools. And, not everybody is completely compliant. I mean, that's human nature. And unfortunately, we are seeing transmission in the schools.
Mark, a quick follow-up. Is this being done elsewhere, the masking aspect of your fourth page? I know you did the joint press conference with Adam Bello last week. Is this being done elsewhere?
I do not know at this point if Monroe County is going to do it. I did inform County Executive Bello earlier today that we would be implementing this in Erie County. As we said, situations vary county to county. I have not been truthfully tracking their numbers the last few days because I've been tracking Erie County's numbers and talking with people in the community. We know that there are high rates of transmission in the rest of the western New York counties. I think a question should be directed to many of those counties, whether they're going to act and take action on their own. I know that a number of the people that are in Erie County hospitals are from other counties, Allegheny, Cattaraugus, Genesee, Wyoming, not just all Erie County residents. But we are the hub. We're the central location for western New York. So we have to act regardless of what they do. I hope they would act appropriately as well. Next question to WKBW TV.
Hi there, Mark. I actually have two questions for you. But first, as many of these businesses are kind of adjusting to the new mask policies, how does the county plan on enforcing the mandate? And also, what's your message to the vaccinated community where so many people got vaccinated to actually avoid this sort of thing from happening again?
Well, to the business community, we certainly are going to do what we did before. We'll send sanitarians out. We will issue warnings as applicable. If we continue to see violations in establishments, we will also, if we have to, fine again. We don't want to do that. We want to be able people to follow the rules. We've had some questions as to whether or not we can fine individuals who are violating it in a business. We are looking into that. We're not certain we can. Actually had a business leader request that instead of the business being fined, the individual who's violating the mask order be fined. We're not certain we can do that, but we are looking into it. We just want everyone to comply. And then to those who are vaccinated, I wish we were in a better spot, but approximately 25% of all adults in Erie County have not even gotten their first dose. I talked about us all coming together and doing this. We saw the president talking about, actually we talked about both presidents, former President Trump, current President Biden, both said get vaccinated for the good of our country. And that's not happened, where 25% of adults in Erie County have not. Dr. Russo told me last week he thinks this Delta variant will continue to spread in our community until it doesn't have hosts to get anymore. And the hosts primarily are unvaccinated individuals. We know vaccinated people can catch it. We're not going to deny that. But the rates of hospitalization are much less. The rates of death are much less for if you're vaccinated. And we do know that vaccination, especially boosters, offers you protection so that you might not even catch it if you're exposed to someone who has it. So to those who were vaccinated, I just say thank you for getting vaccinated. We got 25% of adults in Erie County who haven't even gotten a first dose yet. And if they had gotten their dose and we've been over 90%, I think we'd have reached a herd immunity in a better position. But because we're not, we need to protect everyone. And that includes everyone who is vaccinated, because you could catch it and theoretically give it to someone else even if you don't have a very, very strong illness. And until we can get through this, masking is necessary. Next question to Channel 4. I think Sarah's on from it. Sarah Minkwitz.
Hi, Mark. I mean, with it being the holiday season, more people are going to be gathering. What more can the county do to encourage people, either not to gather in large groups or not gather with unvaccinated people, and of course, get vaccinated if they haven't?
Well, we saw a huge spike last year after Halloween and especially after Thanksgiving. We are expecting another really big spike this year. The one thing we have is vaccines, so people who might be exposed could be protected because of the vaccine, or they might catch it and not even realize it because they're asymptomatic. We didn't have that last year, but we are pretty saddened to see the hospitalization and case rates as high as they are right now. And I talked with Dr. Burstein and the contact tracers. Of the new cases, was it like 85% have some sort of symptoms? So it's not like half of them are asymptomatic. No, the vast majority of cases, about 85% or so, of individuals who are testing positive have some symptoms, whether it's a serious illness or a mild illness. And a mild illness for COVID still might knock you on your feet and you could be basically in the bed for 2 days, but hopefully out of it. A serious illness with COVID is really bad and you could be hospitalized. So we just ask everyone to act appropriately. Here's a perfect example where know your status, get tested before you go into a big group is important, because you might feel great, but you get tested and find out that you're COVID-19 positive, or you're not feeling well. You shouldn't be going into any group if you're not feeling well. First thing you should be thinking about is not going to Aunt Jenny's house for Thanksgiving, but getting tested to determine if you got COVID-19, because you don't want to give it to Aunt Jenny. Aunt Jenny might have the best sweet potato pie ever, but you don't want to get COVID from Aunt Jenny nor give it to Aunt Jenny. So we want people to act appropriately, which means if you're sick, get tested. Don't go to work, don't go to gatherings, don't send your kid to school if they're sick. Get tested and know your status. Call us at 858-2929 and you can get tested before the holiday, though I'm not certain if we'd be able to schedule it now before Thanksgiving, probably not. But there are lots of options out there to get tested just as well. So protect yourself, protect the other people that you're around, and if you're not feeling well on Thanksgiving, do not go to a gathering. If you have a family member that's not feeling well, should not go to a gathering. Person should get tested, because that person might have COVID, and if you go to a place where there's 15 other people, you could spread it, and we are seeing that type of in smaller gatherings and homes transmission. Channel 2, I'm not certain if anyone's on from Channel 2.
Yeah, it's me, Jeff Cabral, County Executive.
Hi, Jeff.
Could you talk about the time gap between phase to phase, presuming that Erie County goes to phase 2, phase 3? Would it be that 3-week time frame, that 3-week buffer?
Well, that is to give us enough time to analyze the data effective as of basically the mask mandate going into tomorrow, because we know individuals basically when they get positive, they'll get hospitalized within a certain days thereafter. So we're looking at that December 13th 3-week is a good indication of what's happening, especially what happened after Thanksgiving. It's not set in stone. If we see a dramatic increase in hospitalizations in the next 2 weeks, we would potentially go to phase 2 sooner. If on December 13th we have no reason to go to phase 2, we wouldn't go to phase 2. We would keep the mask mandate in place at least till the end of the year. So even if we don't see a dramatic increase, if things kind of hang at where they are now, in all likelihood, we'll still have the mask mandate in place till the end of the year. But it's all going to be based on the situation of what we're seeing with the hospitalization rates, the bed counts in hospitals, how bad the emergency rooms are. I mean, if you got appendicitis and you go to hospital, you need to get taken care of right away. You don't want to be sitting there for 5-6 hours if you got appendicitis, as well as new case rates. So case rates are important, but they're not the defining factor. The issues associated with the hospitals are the defining factor. Spectrum News.
And if I could just follow up, though, what would shutdowns look like potentially if the county were to get to that level? Would it be with the restaurants and the bars and the barbershops and all those businesses that we saw shut down a year ago or so?
We'd probably be in a situation where we'd be double the cases and the rate we're in right now for like per population per 100,000 over 7 days. We're at a situation right now where we're basically, was it 460, 470? So let's say 0.1 per 0.5 people out of every 10. So it's, let's say 500 people out of 100,000. If it was 1,000 people out of 100,000, that would be a really bad position to be in. I don't, and hope we'll never even get to phase 2. If we're talking about phase 4, Jeff, we're in a really bad situation with our hospitalizations as well as new cases, even worse than we were last year. Spectrum News. If no one from Spectrum, Fox 29, I think Olivia Dance is on.
Yeah, thank you, County Executive. I actually have 2 questions for you. The first one is relating to the hospital capacity that you've been talking about. Are we at a point where hospitals would have to limit care or potentially turn people away? And also, is the county looking at a location to possibly bring National Guard for makeshift hospitals? And then the second question is relating to, over the weekend, McQuaid and high schools didn't play because of positive COVID cases. So if you could talk about how that kind of played out and where it's going from here. Thank you.
Well, with regards to the hospitalizations, there's a lot of factors driving the hospitalization rates. It's not all COVID. There are other issues that the hospitals are dealing with, including just normal illnesses and the things that they always deal. So, and there's issues associated with the staffing levels they have, where they're having difficulty hiring individuals, just like every other business is having difficulty hiring individuals. So for the hospitals, we have to be very careful. When you call it the National Guard, you're often pulling people that may be working in one hospital and moving them to another. So just in its own, the National Guard might not be enough if we got to a really bad position. We're looking at all options. We certainly hope that the hospitals will be able to keep up and add beds if they can. But to add beds, they generally need the staff to do it. So the conversations we've had with the hospitals are really related to the staffed beds that are available and do they have enough staff to provide the services for the people that they're getting. And I am not going to control the hospitals. I did talk to the governor today and as well as the operations director for New York State, Catherine Garcia, and if they had to, the state would be willing to implement in again an elective surgery prohibition for Erie hospitals. So if it gets so bad that the hospitals are basically booked full, so to speak, the state may actually take measures such as prohibiting hospitals from moving forth with elective surgeries and just leaving it only for emergency surgeries in COVID cases. I don't think we're at that point yet. If we follow the mask mandate, we won't have to worry about it. The issue with regards to the football game was something that took a lot of time on Friday and Saturday. There is a court case that is currently pending, so I don't want to go into a whole lot of detail. But we were aware of on Saturday before the game, there were at least 9 McQuaid student athletes on their football team who tested positive just in the immediate few days before the football game. McQuaid had identified pretty much every player as a close contact to those players. We've since found out at least another and maybe 2 more student athletes have tested positive. We know a coach tested positive. There were no positive tests at the Bennett team. Our rule, as well as the Monroe County rule, is if you are vaccinated, you don't have to quarantine. McQuaid was left with about, I think, 26, 27 players that could have played the game. They elected they did not want to play the game with their vaccinated players. They wanted to play with the unvaccinated. Unvaccinated close contacts have to quarantine. That's the rule. Not just for football, but for school. That's the same rule in Monroe County as we had in Erie County, or have in Erie County. And McQuaid didn't like it. They went to court. They went to court to basically play a game with students who had been exposed to COVID-19 and were unvaccinated in contravention of the rules of Erie and Monroe County. The New York State Physical Fitness Association for High Schools, Robert Zayas, the president, I was on the phone with multiple times, so was Dr. Burstein, and that organization decided to postpone the game out of the safety and concern associated with whether or not there were students who tested positive. It seems like, based on the information we have, that there was at least one student who probably would have participated in that game that may have tested positive since then. So a negative test does not guarantee that you're going to be negative, because we know you can get negative tests on the 5th, 6th, and 7th day and still test positive on day 8 and 9. There is a 2-week window from when you're exposed to when you theoretically could test positive. There is a court hearing that is to be heard. I'm not certain if it's later today. I know there was a discussion about later today or tomorrow. And I'd have to defer to our county attorney's office, but we always are on the protection of public. And protection of the students is paramount. And I'm just disappointed that McQuaid tried to force a football game be played, knowing that their entire team, at least on the information that I've been provided, was exposed to fellow teammates who tested positive with COVID-19. This was not a COVID-19 outbreak 3 weeks ago. This all happened in the last 5 days or so. The first cases were last Tuesday, so less than a week, and from when they would have played the game on Saturday. So it's very disappointing to see that, and I'm hopeful it's resolved. And I just want to say to the people who want to play the game, if they're vaccinated and symptom-free, they should be able to play the game. We don't have a problem with that. We would have allowed the game to be played on Saturday by any of McQuaid's players that were vaccinated and symptom-free. Unfortunately, McQuaid did not like that decision, and they went to court to overrule what has been the standard in Erie County for all schools since schools reopened this past year, and that's disappointing. Do we have any other members of media on who weren't called? If not, we've almost gone an hour. We try to keep these to an hour. I want to thank, of course, Kendra Schmidt for being here and offering the American Sign Language for our friends who may have a hearing disability. I want to thank Dr. Burstein for being here. We certainly have an opportunity to stop this spike. We're seeing some of the highest caseloads, as we've said, in the last week on any one day than we'd seen since the beginning of the pandemic. Some of the caseloads in the last week are some of the highest we've ever seen per week. The hospitalizations, while not the highest we've ever seen, unfortunately are projected to be very high again, and we've seen a rapid spike in cases in the last week. We have a way of prohibiting, or I should say stopping the further transmission, that's wearing masks. So that's why effective at 6 a.m. tomorrow for all public locations where the public is invited in, whether it's a store, a restaurant, a bar, banks, hotels, barbershops, gyms, bowling alleys, everything we've seen in the past. Everyone must wear a mask, including the public-facing employees of those locations. And if we do that, we're gonna stop the further spread of the transmission. And then in the meantime, we need everyone to get vaccinated. I know there's folks out there who won't get vaccinated. Talk to your healthcare professional. Talk to your doctor. Talk to them about why it's so important to get vaccinated. There are people in our community who are dying of COVID-19 who shouldn't die, but they're dying because they were unvaccinated. People under the age of 40, the 50s died in the month of October and early November as a result of not being vaccinated and dying from COVID-19. We've heard the stories all over the place. The family in Saratoga County, the husband and wife and the 2 children, the wife and the 1 child got vaccinated, the husband and the son, who was only 27 with no underlying conditions. The husband, 57, the son, 27, died because they were unvaccinated, while the mother and the other child in their 20s, just had a minor illness for a couple days. Don't risk it. Don't risk it. Delta's really bad. It's spreading like wildfire indoors. Get vaccinated and wear a mask, and we'll all be better for it. To everyone, I'm not certain if we're going to have another press conference before Thanksgiving. We probably will, because we're going to want to share some more data that we have from the Department of Health either tomorrow or Wednesday. But if you don't see me between now and Thanksgiving, have a very happy Thanksgiving and be safe and well. And please be safe. Act appropriately. Take care, everyone.